Treating a stroke patients, here I have written down something for you all. So first, after doing the assessment, the subjective, your objective, and checking all the scales, your GCS scales and all, okay? And as you all know, in stroke we have stages. In stages, which are those? Acute stage, subacute stage, and chronic stage. And as you all know, the best treatment for the patients with the stroke, it should be between 1 to 6 months. That's the time period you get the best result out of that patients. After that also you will get the result, but it will be little bit slower compared to this time period. It can be from 1 to 6 months, 1 to 8 months. After that, usually the recovery process little decreases. Depending on the stages of stroke, your treatment plan should also change. In treatment plan, I'm not talking about your roots approach, your PNF, your static stretchings, or your functional mobility. I'm not talking about that. The approaches which I'm talking about is that they are three: your preventive approach, your restorative approach, and your compensatory approach. Okay, so you need to know when to use this kind of approach. Suppose if my patient is in ICU in the acute phase, recently he had a stroke, so I'm using the preventive approach in this. Suppose I have to prevent what are the complications can happen after stroke. In here you have to look out for shoulder dislocations, shoulder subluxations, or bed positioning, re-educating the family members or the caretakers. If you don't do this kind of exercises, there can be a delay in the recovery process, there can be a postural abnormalities, there can be a compensatory happening later on. So these are the things you have to train or explain to the caretakers. And the early things, even your respiratory approach, the bed positioning and stuff, you have to train to the patients, okay? Your passive movements and all, whatever you're doing in the early phases. And the second will be from 1 to 3 months time period. That is going to be your restorative approach. That means you're going to restore the function of the patients. So in there, you're going to use more of those motor relearning program, task oriented training and stuff, or whatever things which you know, gait training or weight shifting and stuff. Bring back those activities which the patient has been doing his entire life. So do more of the things which he remembers. Suppose I'll give him a task. He has to lift the pen. After lifting the pen, what he has to do is he has to take out the cap. Then he has to hold it in a grip in this way and write it down. So give him the task oriented approach in the restorative phase. Okay. So we have done with the preventive, then the restorative. The third is going to be a compensatory approach on the patients. So these kind of patients are usually chronic. After 8 months or 1 year kind of patients with the stroke, you're going to use this compensatory approach. Suppose what happens in compensatory approaches, they tend to use other accessory muscles or the other side of the muscles more as compared to using the